Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today is February the 11th, 211 Day, and we would like to take this opportunity to thank the City of Windsor and our 211 Southwest Contact Center for their work throughout the pandemic. Since January, they have provided support to the Windsor-Essex County Health Unit by fielding COVID-19 related questions and complaints. Any issue requiring further follow-up by our public health staff is then transferred back to us. So thank you. I will now report our current case counts. Today we are reporting 30 new cases of COVID-19 in Windsor and Essex County. 7 are close contacts of confirmed cases, 6 are related to outbreaks, 5 are community acquired, and 14 are still being investigated. We have had 12,449 cases since last March. 11,825 cases are now resolved, and 274 people are active cases at this time. 42 confirmed cases are currently in the hospital, and 11 people are in ICU. Our community has lost 350 people to COVID. We are reporting 2 additional deaths today. A woman in her 60s from the community and a woman in her 80s from a long-term care home. 226 deaths have occurred among residents and staff in long-term care and retirement homes. There are currently 20 active outbreaks in Windsor and Essex County. 9 are in workplaces, 9 in long-term care and retirement homes, 1 outbreak in a hospital, and 1 community outbreak. In addition, we have dismissed a cohort from a local elementary school due to a high-risk exposure. We are currently in phase 1 of Ontario's 3-phase COVID-19 vaccine distribution plan. Vaccines will be available to older adults in phase 2 and to the general public in phase 3. The Windsor-Essex County Health Unit remains committed to timely communication on vaccine availability and will communicate broadly when there are opportunities to register for the vaccine. Despite the beginning of the vaccine rollout, public health measures must continue. Stay home if you're sick. Limit your close contacts to your household. Maintain a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering. Cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. And download the COVID Exposure Alert app at canada.ca. If you have any symptoms of COVID, no matter how mild, please get tested by calling or booking an appointment online at one of the assessment and testing centers offered at Windsor Regional Hospital or Erie Shores Healthcare. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, and thank you for joining us on this bright and sunny morning. Yesterday, we were notified of our first SARS-CoV-2 virus with a variant of concern. At this time, this was identified using the rapid screening, and the specimen will now be analyzed for full genomic sequence. Once we receive the results of full genomic sequencing, we will be able to share whether this is the variant from South Africa or the UK variant or any other variant. Our team worked diligently yesterday to trace all the contacts, track them to provide instructions, and provided instructions to isolate and or test depending on the investigation. This case during the infectious period, but was not symptomatic at that time, went to a grocery store in Tecumseh. While the risk is low, but due to the variant of concern, we want to share the information more broadly with the community with very specific timeline to ensure that everyone who visited Zaire's in Tecumseh on February 2nd between 12 p.m. and 2 p.m. to monitor their symptoms and immediately contact the Windsor-Essex County Health Unit if they develop any symptoms. Our team will provide additional instructions based on the case investigation. This is a good reminder that while our case rates are stabilizing and showing a downward trend, it can change. Every time any virus is given more opportunities to replicate, the likelihood of mutation increase, and the mutated virus can be more dangerous than the original virus. I want to urge our community to please continue to follow the public health measures and limit your number of close contact and always follow the public health guidelines. You must always maintain physical distancing as much as possible from anyone who doesn't live in your household. Monitor your symptoms daily. Go and get tested if you develop any symptoms. I'll now switch to another topic, and I want to share some vaccine-related data that we have put together. Okay. So, as I present the data, I want to just share this data notes first. Since this is a new system, lots of information, lots of data is being inputted, cleaned as we speak. So these are all preliminary data and is subject to change. The statistics that we are providing in the slides will not add up due to some quality challenges. And what you're looking at with respect to doses administered, it doesn't necessarily mean that the doses received by the residents living in Windsor-Essex. For example, there may be reasons for some of these individuals who are living outside of Windsor-Essex and have received the vaccine in Windsor-Essex for one reason or the other. So the slides look at the number of unique individuals living in Windsor-Essex that have received the first dose and the ones that have completed their series, meaning have received their second doses as well. So in total, approximately 18,452 doses have been administered to 11,762 Windsor-Essex residents, and this includes both Moderna and Pfizer vaccine. So overall, in total, we have 6,690 individuals who have received both their doses of vaccine and they're fully protected. And we have 5,000 individuals who have so far received only one doses of the vaccine and are on schedule to receive their second doses in a timely manner. Focusing just on the long-term care home and retirement home, this is what the breakdown looks like. And as we can see, most of our long-term care home residents have already received their 2 doses of the vaccine, while when it comes to the retirement home resident, half of them have received the full 2 doses, and the remaining half is left with the second doses. And we can also see that many of the long-term care home workers and retirement home workers, they have also received their second doses for the most part, up to like 60-70% of 70% of the cases. With respect to the dose administered by type in Windsor-Essex to overall similar group, long-term care home and retirement home, we can see that more than 3,600 doses were administered to long-term care home residents, retirement home residents more than 2,500 doses, and then the rest of the employees in the acute care long-term care home, and then the workers in the long-term care home and retirement home. So overall, in summary, what we can say about the residents in the long-term care home and retirement home, we have 90%, close to 90% coverage in both these facilities, whether we are talking about the long-term care home or retirement home, that have received their immunization with at least 1 dose of Moderna vaccine. In both the groups, as we can see, it's very close to 90%, and the other 10% are due to reasons such as if the facility is still in outbreak and the individuals cannot get the vaccine because of active disease or because of their existing medical condition, if they're still recovering and are not fit enough to receive the vaccine, or in some rare cases when they have refused to receive the vaccine. But overall, the good news for our community is we have 90% of these facilities now protected with at least 1 doses, but more than half of these residents have received their 2 doses. We're on track to complete their full vaccination with the second doses to keep our vulnerable population protected in our community. Thank you.
We'll now take questions from the media. Today we'll start with CBC.
Did you say CBC or CPB?
Oh, CBC.
Okay, just checking. Dr. Ahmed, I wanted to ask about the debate over March break. Do you think it should go ahead this year, and do you see it affecting COVID-19 cases in one way or another?
So I think it's more of a question for a policy rather than any public health concerns at this time. I'm indifferent with respect to the actual break. There are some risks, there are some benefits. At this point, I don't have any particular position on what to say. It's mainly a policy decision to me at this time.
Okay, and earlier this week you said that there would be a conversation between you and the province regarding future COVID restrictions for next week. I'm wondering if you've had that conversation yet with the province.
I did had the preliminary conversation, and we will be having another conversation before the end of this week for before the announcement happens by the cabinet and the premier. So we've been in conversation with the ministry at this time.
Thank you.
Any questions from Blackburn?
Yes, good morning. I don't know, going back to your chart regarding who in the long-term care home, so you've separated them between acute worker, like nurses and doctors and acute care, healthcare workers with the PSW is a healthcare worker. I would assume that the PSWs are working more directly with the patients for longer periods of time. So how are they categorized?
So I am trying to go back to the slides. Employees and so that includes some of the other the healthcare workers, whether we're talking about other support people coming into the home to support these facilities, whether we're talking about the doctors and other support workers in that population. I'll have to look at those details again. I'm not 100% sure if that's accurate, but this is my understanding that it should include the physicians and the employees that work in these sectors.
I'm just wondering if one is prioritized over the other. It seems like employees in acute care have received more than just a general healthcare worker in the retirement homes and long-term care homes.
No, some of these hospital data or the healthcare worker data, it's not included in this distribution, because we want to focus on the data that is clean right now from our reporting perspective, and this data we wanted to focus on the long-term care home and retirement home. So this data is generally about those workers, and it doesn't necessarily include the healthcare workers in the hospital system that have been vaccinated so far.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. Doctor, are all local tests that are positive now being tested for variants? I believe the province announced that was the case earlier this week, but I just wanted to confirm.
I'll pass it on to Teresa, because I think she reviewed that document.
Yeah, that's my understanding, that the positive results are being tested for the variants.
Okay, and how concerning is it that we have detected one variant in this community, or was it just a matter of time?
Well, I think it was a matter of time as we see that these variants are appearing in different parts of Ontario, and it's a possibility that people will contract it, and that's why it's really important for us to know how we can protect ourselves and how we can keep our communities safe. Any travel, any close contact with people that you do not live with, it increases your risk of acquiring COVID, and I think that's why some of my messaging continues to be the same, that variants are here, and the more opportunity we give this virus to replicate by spreading in the community, it is more likely that it will mutate. And we don't know if the mutation will be much more dangerous, much more transmissible in the community, and if the mutation would be something that is already identified, or maybe it could be entirely a new mutation. So all of those things happen when a virus such as the SARS-CoV-2 replicate as much as it's replicating right now. So it is a concern, and we as a community needs to understand that the situation can change anytime, And we must follow all of these recommendations, all of these guidelines when we are out and about with anything which we are doing.
Okay, and then separately, I know phase 1 of the vaccine rollout plan includes adult chronic home care recipients. Has that population begun to be vaccinated yet?
No, but we are working with the LIN regarding this group of adults, and we do have about 6,000 in Windsor and Essex County, so we are working with them. We don't have the vaccine yet for that group, but we're working on the overall plan with our health unit.
Okay, thank you.
Any questions from AM 800?
Dr. Ahmed, in regards to the variant, it just seems like for us in Windsor-Essex, we take so many steps forward and now we have this roadblock again. Is it frustrating for you, disappointing? It seems like we make so much progress and then we have another obstacle in front of us.
Well, I think the only thing that this pandemic has taught us is that we cannot rest. And this has been going on for more than a year now, or close to a year now. And I think as a community, we are resilient. We came through, we fought many battles. And this was not, I wouldn't say that this was completely unexpected, because we know that the variants exist in the province. So it was just a matter of time when it shows up. I think the key is, what are we doing about it, and how quickly we can act on it. So right now, if you're looking at it from the timeliness and how quickly we can reach out to this individual, we have a relatively stable case count, so we can act quickly. The requirement for the identification of close contacts and the actions that we need to take is at a much higher level compared to what we normally do with the other cases. The definition of close contact is different than what we see in the with the rest of the COVID cases. So it generates a lot of work. At this time, we do have the capacity, but when things start to change, it can be a problem. And that's why I think the key part is, we don't want it to replicate in our community. We don't want more of these viruses showing up in our community. So right now, it's a community case. It's not linked with any high-risk locations, such as a long-term care home or retirement home, thank God. And we want to make sure that it stays that way, because we know if these type of variants get into these long-term care home or retirement home, it can be really, really dangerous, and it can be really tricky to control it. We don't know all of those details, that how it would shape up, but I think overall, as a community, we have to act. We have to make sure that we are following all these guidelines.
You mentioned there'll be additional testing to see where or which strain it is. How long will that usually take?
It could take up to a week, because they have to do like a full genomic sequencing to identify all the mutations, and then cross-reference it with the previous mutations that have already been identified in different jurisdictions, and do more of those details. But to my understanding, it would take up to a week timeline, or 7 to 14 days. So maybe a week to two before we get the final results.
Thank you. And just a question for Teresa. Teresa, in regards to the doses, the individuals that receive the doses, are those numbers in line with the schedule that you and the team is working with?
Yes. We have the long-term care and retirement home residents numbers are for other doses, and as I said, next week we'll have 4 more retirement homes on, well, actually 3 on Monday, and then 1 more on next week on Wednesday. Nope, 3 on Monday and then 1 on Thursday, and then we'll be done the retirement homes. So we've moved basically out of the long-term care homes and into the retirement homes and getting them completed. In saying that, we are, going back to immunize first doses as well in those remaining residents, but I don't have that updated number.
I'm not sure if you have this number in front of you or if it's even possible to share with us, but how many people each day would you say are receiving the vaccine? Is it obviously in the hundreds, or what would you say?
Yes, so today, it depends on the size of the home and who received their first doses. So some homes are smaller than others, but like for instance, today, I'm just quickly adding up here. It looks like maybe 300 people, 300 today should get their second doses. So it depends on the size of the home. Some homes have 50 residents and others have many more, but it varies.
Thank you.
Any questions from CTV?
Yes, good morning. Are you worried about a potential third wave in March or April, especially now that the new variant has arrived, and what can be done to prepare for it?
Well, I think the possibility of third wave will always exist, and it all depends on us. Just like I've said this many times, in September and October, we have the opportunity to shape what kind of future we want, whether we want to be in lockdown or whether we want to continue to have what we generally enjoy. And it's a shared responsibility. It's a responsibility that all of us have to work towards. We have seen September, October, when our community did very well compared to many of the communities in the province of Ontario. So it's not impossible that even, let's say, when we get to a third wave, when the rest of the province is going through large number of cases, we can still be where we like to be. And so I'm not necessarily concerned just with the variant. I think we need to put things into perspective more generally, more broadly, and should focus on what do I need to do, because it's the same virus. It's still spread the same way. It may take less time to get infected with COVID in these type of situations. So I think we should remember that. We should recognize that this is not just the concern due to variant. It is a concern more broadly. We all need to do our part to keep our community safe and follow all these public health measures.
Great, thank you.
Any further questions from CBC? Any further questions from Blackburn?
Yes, actually, switching gears a little bit, I have a couple questions from my colleague Adele. She is looking into some overdoses and was wondering if, I don't know if you have these figures in front of you, if you have numbers about the spike of overdose since September of 2017 in Windsor-Essex.
So I don't have that data in front of me, and I know Mike did mention that request, and maybe someone from our team can connect separately with you. But what you can do is you can go to the Public Health Ontario opioid tracker data, and that particular website has all the information broken down by the health unit. And you can take a look at the data and you can choose the timeline where do you select for all those data. But if any other request that goes beyond that, maybe we can try to see if we can accommodate that or not. But the Public Health Ontario website and in particular opioid tracker would give you the answer that you're looking for in terms of the overdoses or whatever data is collected, who ended up in emergency department or admission, or any opioid related deaths in our community.
And would that include information up until 2020?
That will be the most accurate data they will have that they can share. Obviously, there's some lag in data. So you may have the data that may be as accurate as maybe 3-4 months earlier, but not not instantly, because there's a lot of data cleaning and everything that goes on before they can provide that data. I think what I'm looking at right now is they have data up until June of 2020.
Okay. Anecdotally, I know you've mentioned in the past that, the pandemic has kind of acted as a stressor. Would you say that there's been a spike since the pandemic started?
Absolutely, and I think we shared some of that data, or if not, then maybe we'll try to put some numbers together. We have seen more opioid related admissions and opioid related ED visits. So we have definitely seen that increasing. But also on the flip side, there are many overdoses that we have to say that are not reported. Their 911 is not called, so there is no documented evidence of an overdose. And most of these overdoses sometimes are reverted by the agencies where these individuals generally hang out, or within their peers who may use naloxone to reverse the overdoses. So a lot of that would be unreported, and overall, knowing from within working with our partners and looking at our data, the data definitely suggests that there is an increase that happened.
Okay, and last one from Adele. She's wondering if fentanyl is still the most common drug associated with overdose.
Well, the last alert that we issued was specific to the fentanyl, so we know that part. And sometimes it takes some time to figure out the exact composition of what type of drugs are involved. But I think, if I recall correctly, last couple of instances when we reported, it was linked with fentanyl.
Thank you.
Any further questions from the Windsor Star?
I'm just wondering if you have any update on when the health unit will receive its next shipment of Moderna.
No, we haven't received any confirmation about when the next shipment's coming.
Is that concerning, or do you think, is it typical so far that it has taken a while to find out when you're going to get your next batch?
Well, initially we were told that Moderna would be coming to Canada every 3 weeks. There'd be a shipment, but we've only received 2 shipments, as you know, so we don't have any other further information on any shipment coming at this time. But we are, we do get that information from the ministry, but there's been no communication about the next shipment at this time for Moderna.
Okay, thank you.
Any further questions from AM 800?
Dr. Ahmed, just one. Yesterday we did a story with Peely Island's mayor. The council in the township of Peely is asking government officials to allow U.S. citizens to cross the border to check on their properties. I believe we talked about this in the summer, but just want to get your thoughts on their request.
So I haven't seen that story, I guess, and what your question is. If people are visiting, it does raise the concern overall for the community, and knowing that Peely Island is a very secluded community, and we want to make sure that there is no exposure, there is no transmission that happens in that island. We recognize that there are challenges with the healthcare. We recognize if there is any need, or if it spreads uncontrolled. So that would be something. So I don't know all the details of who exactly coming, but in general principle from a public health perspective, those are the reasons that we always say about people visiting from one place to another, and even when people are trying to go and meet their loved ones. So I think from a public health perspective, our message is the same, that we want people to be less mobile. We want people to stay within their own household. But I don't have any particular say in terms of their request to the government and what they would say and what they would do.
Okay, thank you.
Any further questions from CTV?
No, thank you.
Thank you, everyone. Have a good day.
Thank you.